Hello everybody, this is Joey. Joey has been complaining of right shoulder pain for how long, Joey?
It's about 8 months.
About 8 months now. So about a month ago now, she was referred for a corticosteroid injection. She had immediate pain relief, and that's probably due to the analgesic component they would have put in the corticosteroid. And that lasted for about 5 days. Yeah. A week ago, so 3 weeks after the first injection, she was referred for a second corticosteroid injection. Now this time, unlike the first time when she got immediate pain relief, you didn't get that immediacy of pain relief. Okay. For those of you who know, you might be aware that shockwave therapy is contraindicated with corticosteroid injection. So we did not treat the tendon, which on MRI scans is showing some impingement signs. So we've got signs of inflammation in the bursa, and we're also seeing some signs of calcification within the tendon. The shockwave would have been an ideal intervention, but if you have a corticosteroid injection, then it's contraindicated for at least 6 weeks after the injection. So we did use shockwave, but over the trapezius, the upper trapezius, because Joey had a really sort of nasty myofascial trigger point. So we used the shockwave over the trigger point, and that increased our range of movement. She's now presenting to us sort of 3 weeks later with less pain. So we're going to repeat that, okay, because we've got signs of still having a bit of a trigger point there. And I'll show you some sort of tips and tricks for treating upper trapezius. For these impulses to get through your skin, we put a water-based gel on, and the more gel we put on, the better. One of the issues that I see with people is they'll put a little dab on the end here. Okay? Within about 30 seconds of treatment, that's rubbed into the skin. So for the rest of the time, the patient isn't getting treated. So use plenty of gel. The intensity is gradually going to build up, Joey. Okay. You're in control. If you feel it gets too much, just tell me, we'll stop.
Okay. Now, when we're treating upper trapezius, I don't point down into the lung tissue. You notice I'm really just doing a PA movement. I bring the back through the trapezius. And here's the trigger point. I can feel that resistance there, like a big knot in the muscle. With some patients, if you go directly through here, it can create a cough reflex. This is not causing harm, but it's not particularly pleasant for the patient.
So leading with your thumb, can you take your arm up towards your ear and tell me?
It's much better.
Much better.
Much better, yes.
Okay, and the quality of movement is definitely better, isn't it? That's good. Okay, and come back down. Excellent, well done.
Oh, wow.
Yes?
You.
We have a happy patient, which is good. Okay, lead with your thumb, and we were getting pain at 90 degrees.
Also.
Okay.
Much better.
Much better.
Much.
Wonderful. With any tendinopathy, we always have an associated myofascial trigger point. And in order to get the most positive outcomes, you should always treat both areas. And my recommendation is to always treat the myofascial trigger point first, because that can be actually the source of pain, because trigger points can refer pain distally. Okay? But it has been demonstrated on MRIs that we've got an inflamed bursa. We've also got some other signs of impingement. We've got some calcification within the tendon. Now, I can't use shockwave over the tendon, because she's had a corticosteroid injection a week ago. And typically we leave at least 6 weeks between having a corticosteroid injection and shockwave therapy. So to address Joey's pain, we're going to use our LightForce therapy. And the LightForce therapy has 2 wavelengths. One which is going to work directly on the cells to speed up her natural healing process, and another wavelength that has a direct influence on nociceptors, which is going to block the pain. Now, when I use LightForce, I treat the source of pain, but also where the pain is controlled at the dorsal root ganglia, because the nociceptors are sending signals from here to the dorsal root ganglion at the associated nerve root, which determines the location and type of pain and then informs the brain how to react. Joey, we use protective eyewear, okay? And I also wear some protective eyewear as well. We come to the device here, and we're going to put in some information about Joey into the machine. So height-wise, Joey's quite small. She has a medium-sized body, and then we need to put her skin colour, because the more melanin that you have in your skin, which is a chromophore, which absorbs light energy, so the darker your skin, the more energy will be absorbed. So we use something called the Fitzpatrick scale, which goes from 1 to 6. Now, looking at Joey's skin, she's going to be about a 3 on this Fitzpatrick scale. Okay, so we've chosen that, and this has been going on now for sort of eight months. So we're going to treat that as a chronic condition. So we come here, and now we have a body chart. So we tell that we're going to be working on the shoulder, and we get a list of pathologies coming up here. And we can choose. We select here, and there's our protocol, guys. Okay, you'll see it's a very short treatment, 2 minutes 40 seconds. This is a 40-watt device. So it means that our treatment times are much quicker, which ensures that we have plenty of time within our therapy session to do any manual therapy or exercise prescription that we want. But also what the research has shown is that the higher power that we have, the more immediacy of pain relief that we get. So I've got various transmitters here in different sizes. So I can have on contact small, I can have off contact. Now, I would use off contact if we've got a very swollen, painful joint, or let's say it's post-op and we have we have open wounds or portal scars that we want to avoid. But if we use an on-contact device, we get 15% more energy into the tissue than we do with off-contact. So wherever possible, we want to use on-contact. We have a nice silicone roller ball here. So as far as Joey's concerned, it's going to feel like having a nice warm massage. Okay. I'm just going to work through that tendon. And I'm using a grid pattern. You'll see that I'm going up and down over the affected area, but then also coming across the area. So you'll see we have a traffic light system. You'll see now that this is on green, so I'm working at the correct speed. But if I slow down or even stop, you'll see it goes red and it tells me to start moving again quickly, because otherwise the patient's going to feel heat and not be pleasant. Now you will note that Joey has a tattoo. And the ink in tattoos act like a chromophore. In other words, they attract the light energy. And the darker the tattoo, the more light is absorbed. So you will note that I am avoiding the tattoo. You can treat over tattoos, but it's recommended that you reduce the prescribed energy by at least 50% and work as quickly over the affected area as possible. Joey, we've had 2 sessions of LightForce Therapy now. When you first came, you had a painful arc in your shoulder movement. How's that feel now?
Much better, and I'm feeling okay. No pain, actually.
No pain. Well,
Yeah,
that's fantastic.
Yes.
And could you show the camera your range of movement going out to the side? Wow, fantastic. Okay. Now, one of the big problems that you had was sleeping.
Yeah.
And
Yeah.
how's that now?
For the last 2 nights, I could sleep very well. Actually, I could sleep on the side now as well. Not a long time, but I can sleep on the side now, and it's much better.
Fantastic.
Yes.
Okay, that's great. Well, thank you very much. So obviously, even after 2 sessions of LightForce Therapy, making a big difference to Joey's life. Okay.
Thank you very much.
You're welcome.